I used to do triathlon, and one of the events that I was doing, I didn't have a terrific finish to it. I felt like I was dragging the whole left side of my body, which, as it turns out, I was.
When you see someone like Brandon coming in with concerns of Parkinson's, the thing that stands out the most is his age.
He's a young guy, young family, a lot going on, really active, but obviously having more trouble with that.
It was pretty much a gut punch for me to hear that I had Parkinson's. To find out you have a brain disorder that there's no cure for and it's only going to get worse was pretty rough.
No question, Parkinson's disease is disruptive and distracting. There is no one person that's going to be able to really comprehensively take care of everything that a Parkinson's patient is going to need.
It involves a lot of people. So at Penn State Health, what we're most proud of is that we truly have multidisciplinary care for our patients. We have neurology and neurosurgery, neuropsychiatry, our therapists, our advanced care providers, our nurses, everybody is part of that team.
Coming to Penn State Health was literally like hitting the Powerball. Treating the person as a human being and with compassion and empathy goes just as far as treating them with medication.
Continuous DBS has been around since the 1990s. Adaptive is a next step in the technology where we're able to record from our patients' brains their personal rhythms, and now we have a system that we can set it up to modify and fluctuate depending on what's going on throughout the day.
This is the adaptive DBS device. It's both a battery and a computer. It's implanted in the patient's chest underneath the skin. It's connected to the wires that go into the brain. It downloads all the information and we can pick it up and make full use of it. It's a huge leap of trust to let somebody put a wire in your brain, So if we don't have that relationship, there's no way we can get to that point.
Looking back with the success that I had with it, I kind of wish I would have done it sooner. This is my adaptive DBS, and Dr. DeJesus is going to turn it off so that you can see the difference.
All right, Brandon, we're going to turn it off now here.
Obviously, the tremor is much more pronounced. Can't really control it. My eyes are closed because my head shakes.
Yeah, I can see your right shoulder, right, tenses up.
Yep.
I'm going to turn it back on, okay, Brandon?
Yep. It brought me to tears. My wife and I, actually there wasn't a dry eye in the room when they turned it on.
He had improved control of his symptoms where his tremors wouldn't break through as much, and just generally he felt more alert and awake and active throughout the day.
Movement is medicine, and there's lots of studies out there for Parkinson's that your long-term prognosis improves the more active you are. I'm actually teaching Parkinson's spin classes and taking Parkinson's boxing. Back to being able to go on dog walks and enjoy vacations and things like that. It's really made a marked difference in my life.
When a patient comes to Penn State Health, they're getting not just the clinical care, it expands a world that involves research and education and truly thinking about the person as a whole and how we can improve their lives within the diagnosis.
Having a resource like Penn State College of Medicine means that everything that we do, we're focused on learning from. I mean, that's how medicine grows. We build one step at a time. We know a lot more now than we used to. And we'll know more tomorrow too because of all the things that we get to learn.